If you've been advised to have a transperineal prostate biopsy under local anaesthetic, you may understandably feel a little anxious or uncertain. I'm Craig Jones, a consultant urologist and urological surgeon, and in this video I will explain what the procedure involves, why it's done, and what you can expect before, during and after your biopsy. A prostate biopsy is a procedure used to take a small sample of tissue from the prostate gland so they can be examined under a microscope. The transperineal approach means the biopsy needles pass through the skin between the scrotum and the back passage, an area called the perineum. This method lowers the risk of infection compared with older biopsy techniques. You may be having this test because of a raised PSA blood test, an abnormal prostate examination, or findings seen on an MRI scan. The biopsy helps your medical team determine whether prostate cancer is present, and if so, how significant it can be. Before the biopsy, you'll be asked about your medications, especially blood thinners, and any allergies. Most patients can eat and drink normally before the procedure, unless advised otherwise. And you'll also have the opportunity to ask questions before signing a consent form. The procedure usually takes around 20 to 30 minutes. You'll lie on your back with your legs supported comfortably, and the skin is cleaned carefully to reduce the risk of infection. To make the procedure more comfortable, local anaesthetic is used to numb the area around the prostate. The injection is very similar to the numbing injection you might have received at the dentist before dental treatment. You may feel a brief, sharp sting or a sensation of pressure for a few seconds, but after this the area quickly becomes numb. An ultrasound probe is placed into the back passage to help guide the biopsy needles accurately. Once the area is numb, several small tissue samples are taken from the prostate. You may hear clicking sounds from the biopsy device and feel some pressure or movement, but most patients tolerate the procedure very well. After the biopsy, you'll usually be able to go home the same day, and it's common to notice mild discomfort or bruising, a small amount of blood in the urine, semen or stool for a short time, some temporary urinary symptoms, and these symptoms usually settle within days to weeks. Although complications are uncommon, contact your healthcare team urgently if you experience fever, chills, or difficulty passing urine, or heavy bleeding, or severe pain. Your biopsy results are usually available within 1 to 2 weeks, and your doctor or specialist nurse will discuss the results with you and explain any next steps if needed. We understand that having a prostate biopsy can feel worrying, but the procedure is commonly performed and generally very well tolerated under local anaesthetic. If you have any further questions, please speak to your healthcare team.